Hi, my name's Jodi Mitchell. I'm the Executive Director of Kentucky Voices for Health. We are a consumer advocacy coalition of over 250 organizations and individuals who are working together to improve the healthcare of Kentucky. We strive to build consensus on health policy issues related to access, prevention, children's health, and efficiency and effectiveness of the healthcare delivery system. Kentucky Voices for Health is responding to this ever-changing and dynamic changing landscape in the healthcare area. We have a lot of changes going on right now, including the implementation of managed care in our Medicaid system. We also are on the cusp of implementing the new health reform law, and so that has a tremendous impact on the state as well as on those who need coverage, and we're trying to improve the accessibility of insurance coverage. And then we look at prevention, because that is a way of us streamlining some of the healthcare costs. If we can prevent these chronic conditions early on, then we can work to improve the wellness and allow individuals to live healthy lifestyles. Kentucky Voices for Health is concerned about the implementation of managed care in the Medicaid program in the areas of access, quality of care, and also the efficiency and effectiveness of delivering health care to Kentuckians. We have heard of concerns with the implementation as far as patients not being able to access their medications because of problems with pharmaceutical cards or because of prior authorization, which is the review that the managed care companies take to review the cases before they approve certain care and certain treatment and certain services. The implementation of managed care in our Medicaid program has tremendous impact on consumers. There is a great deal of hope that managed care would provide increase in coordination of care and increase in focus on prevention. But what we are seeing, we're past the 90 days implementation, and what we're seeing are tremendous hurdles to getting the care that is needed, whether it be through pharmaceutical treatment and not having access to certain drugs, or whether it be that they can't get a provider who is participating in these Medicaid managed care programs, or that the providers are going out of business because they have not been reimbursed for the services that are provided. And so this is all building up into a system that is going to be fraught with problems if we don't address them now. We've heard a lot in the recent weeks from the providers about prompt payment, and it affects consumers, because if doctors are going out of business or closing their doors to Medicaid members, then it's an access issue. And so we're very concerned about that. And we want to work with Medicaid members, with providers, to bring these concerns to the Cabinet and to the MCO representatives to try to find a quick remedy. Our top priority is access to high-quality health care for all Kentuckians. And so this implementation of the managed care into our Medicaid program really has affected access to care, at least from the stories that we're receiving in the personal testimonies straight from consumers and providers alike. We are concerned that Medicaid members are having to jump through hoops to get the care that they need. Pharmacy has been a huge concern. I received a letter from a mother whose child has now gone without their allergy medications and for 3 weeks because the pharmacy and the MCO are not communicating with one another. Kentucky Voices for Health has an online web form where individuals can go and let us know of their concerns, and that we can work with them and bring to light some of the problems and some of the hurdles that they're facing.